Somewhere in the world right now, a human heart is beating inside the chest of someone who was once told they might not survive. Not a machine. Not science fiction. Another human's heart. And the strange part is how normal modern society treats this now. Hospitals discuss it calmly. Medical journals publish statistics. Insurance companies calculate costs. Governments debate organ donation policy. Meanwhile, if you explain the idea of heart transplant surgery to someone a few hundred years ago, it would sound completely impossible. Take the heart from one body, place it inside another, and somehow, life continues. That is one of the most extraordinary realities in modern medicine. But behind the miracle is a system filled with scarcity, economics, ethics, technology, and uncomfortable math. Because the biggest problem in organ transplant systems globally is not surgical skill anymore. It's supply. There are far more patients needing organs than available donors. And that creates a brutal waiting game. Some patients wait months. Others wait years. Some never receive the call at all. Which makes the modern transplant system emotionally difficult and economically fascinating at the same time. Because every transplant requires an enormous invisible network operating perfectly under pressure. Doctors, surgeons, transport teams, coordinators, labs, matching systems, emergency logistics, legal approvals, intensive care units. One successful transplant may involve hundreds of professionals working across multiple systems simultaneously. And timing controls everything. A donated heart cannot simply sit in storage indefinitely like a warehouse product. Once removed, the clock starts immediately. Transportation becomes a race against biology itself. Modern civilization built delivery systems capable of moving food, phones, and luxury products across continents rapidly. Now those same systems sometimes move human organs. That sentence still sounds unreal. The first successful human heart transplant in history happened in 1967 in South Africa. At the time, the world reacted with shock. Some people saw it as a medical revolution. Others saw it as deeply unnatural. Which is interesting because almost every major medical breakthrough initially makes society uncomfortable. Vaccines, anesthesia, organ transplantation. Human beings often fear revolutionary medicine right before normalizing it. But early transplant medicine faced enormous problems. The body's immune system is designed to reject foreign tissue, which normally protects humans from disease. Unfortunately, transplanted organs trigger the same defense system. The body sees the new heart and says, "This does not belong here." That's the hidden paradox behind transplant medicine. Human survival systems sometimes fight life-saving treatment. And for years, rejection remained one of the biggest obstacles. Patients survived surgery but later faced immune complications. Over time, however, advances in immunosuppressive drugs dramatically improved survival rates. Modern medicine essentially learned how to negotiate with the immune system. Not perfectly, but enough to change history. Meanwhile, the economics surrounding heart failure treatment became enormous globally. Chronic heart disease affects millions. Aging populations increase demand further. Healthcare systems spend billions managing cardiovascular conditions every year. And eventually some patients reach a stage where medications and conventional procedures are no longer enough. That's when transplantation enters the conversation. But here's the uncomfortable reality most people never think about. Not everyone has equal access. In wealthier countries, advanced transplant centers may be more available. In poorer regions, patients may struggle with cost, infrastructure, or donor shortages. Geography can quietly shape survival odds. Again, healthcare becomes connected to economics. The irony is impossible to ignore. Humanity developed the ability to replace failing hearts, yet millions still lack access to basic preventive healthcare that could reduce heart disease earlier in life. Technology advances rapidly. Access does not always follow equally. And then there's the emotional complexity. Because every transplant story contains two realities at the same time. One family experiences hope. Another experiences loss. That emotional balance makes organ donation conversations uniquely sensitive worldwide. At the same time, misinformation online complicates public understanding. Movies exaggerate transplant science. Social media spreads myths. Some people imagine personality transfer through organs, as if receiving a new heart suddenly changes identity completely. Reality is far less cinematic. And somehow even more remarkable. Because what actually changes lives is not magic. It's coordination, science, timing, and human cooperation at extraordinary scale.
The truly strange thing about heart transplant recovery is that survival after surgery becomes its own long-term system. The operation is not the ending. In many ways, it's the beginning. Patients often require lifelong monitoring, medication management, regular testing, and immune suppression treatment to reduce rejection risk. Modern transplant medicine doesn't simply replace an organ and walk away. It creates a permanent medical relationship between patient and healthcare system. And that relationship is expensive. Globally, healthcare costs connected to advanced surgeries continue rising. Specialized surgical teams, intensive care technology, medications, recovery monitoring, laboratory analysis, everything compounds financially. Which creates another uncomfortable question. What happens when life-saving medicine exists, but affordability becomes the barrier? This is where healthcare debates become political very quickly. Some countries rely heavily on public healthcare systems. Others depend more on private insurance. Some patients receive support. Others face enormous financial pressure even after successful surgery. The science may be global. Access rarely is. Meanwhile, researchers continue exploring alternatives to traditional donor systems. Artificial hearts, stem cell technology, bioengineered tissues, even experimental approaches involving 3D bioprinting. Humanity is gradually attempting something astonishing, building replacement organs. Not borrowing them, creating them. Which sounds futuristic until you realize research laboratories are already actively exploring these possibilities. Still, despite technological progress, one limitation remains stubbornly human: donor shortages. And this shortage reveals something emotionally uncomfortable about modern society. Most people support organ donation awareness in theory. Far fewer actually register as donors. That gap between public support and real participation creates consequences hospitals deal with every day. And because transplant demand exceeds supply, medical systems must prioritize patients carefully. Doctors evaluate urgency, compatibility, survival probability, overall health conditions, and multiple other factors. Which means healthcare systems sometimes make decisions carrying enormous emotional weight. Who receives the next available heart? Who waits longer? Who may not survive waiting? These are not movie scenes. These are real policy and medical questions happening globally. At the same time, modern media often presents transplantation either as a perfect miracle or a terrifying medical procedure. Reality sits somewhere in between. Heart transplants save lives. But they also involve lifelong complexity. Medication side effects. Monitoring. Infection risk. Psychological adjustment. Ongoing uncertainty. Medical progress rarely arrives without trade-offs. That may be one of the most important lessons in modern healthcare. And yet, despite all the complications, survival rates and transplant outcomes improved dramatically over recent decades. What once seemed impossible became increasingly routine inside specialized medical centers. Which raises a fascinating question about human adaptation. How quickly do impossible ideas become normal once society gets used to them? The first heart transplant shocked the world. Today, many people scroll past transplant headlines in seconds. Human beings normalize miracles surprisingly fast. But there's another layer beneath this story most people rarely notice. Prevention. Because many severe heart conditions are connected to larger global patterns: diet, smoking, air pollution, stress, sedentary lifestyles, limited healthcare access, economic inequality. Modern civilization created extraordinary medical technology capable of replacing failing hearts. Yet at the same time, many societies still struggle reducing preventable cardiovascular disease risks at population scale. In other words, humanity became incredibly skilled at repairing damage, not always preventing it. And maybe that's the quiet contradiction behind the entire global heart disease crisis. The future of medicine may not depend only on how advanced surgeries become. It may depend on whether societies finally